You ran this morning. Your last checkup was clean. Your doctor called you healthy. So why could you still drop dead from a heart attack today? Because feeling healthy and being healthy are two completely different things. That invisible gap between how you feel and what's actually happening inside your arteries, that's where millions of people have died without a single warning. Today I'll show you exactly how it happens, why your body hides it, and what you can do before it's too late. Your heart runs on oxygen delivered through vessels called coronary arteries. The most critical one is the left anterior descending artery, the Widowmaker. Block a small branch and you lose a leaf. Block this one and the whole tree collapses. Here's how danger builds quietly. High blood pressure, elevated blood sugar, and inflammation act like sandpaper on your artery's inner lining over decades. Microscopic scratches form. Your body sends LDL cholesterol to patch them. White blood cells arrive, consume the cholesterol, harden into foam cells, and fuse with calcium and cellular waste into deposits we call plaque. This process, atherosclerosis, often begins in your 20s while you feel completely fine. Most people picture a heart attack like a slow drain clog. The pipe narrows until flow finally stops. Logic says you'd feel it coming. That logic is wrong. As plaque grows, your artery wall expands outward to keep the opening clear. Blood flows normally. You feel great, while a massive silent deposit hides inside your artery wall, invisible without imaging. This is called positive remodeling, and it is your body's way of masking a ticking time bomb. This is why for 50% of men and 64% of women, the first symptom of heart disease is sudden death. No warning, no pain, just the end. Soft, unstable plaque acts like a blister, an inflamed pocket under a thin membrane. A blood pressure spike, intense exertion, or stress surge can tear that membrane open. Plaque ruptures. Your body panics and sends platelets to clot the site. That clot seals the artery shut within minutes. Heart muscle begins to die. Here's what shocks most people. The majority of fatal heart attacks happen in people with less than 50% blockage. Not 90%, less than 50%. Because soft, unstable plaques rupture, not the large, hardened ones. There's also a second type. A fit 50-year-old runner mid-race feels off, fatigued, slightly lightheaded, no chest pain. At the hospital, troponin shows up in his blood, a protein that only appears when heart muscle cells are breaking open and dying. Heart attack confirmed. But his artery is only 50% blocked, not fully closed. This is a supply and demand failure. At rest, 50% restriction is manageable. At 170 beats per minute, his heart demands far more oxygen than that crimped artery can deliver. The muscle suffocates. Add atrial fibrillation, upper chambers quivering instead of beating, and the heart can't fill or deliver properly. Tissue dies even with blood still technically flowing. Over years, your heart can grow small detour vessels around blockages, collateral circulation. It's why a 70-year-old with decades of slow disease may survive a heart attack that kills a healthy 40-year-old instantly. The older heart built its reroutes. The younger heart had none. Exercise builds this network. Consistent cardio and interval training actively encourage collateral vessel growth, constructing the detours that could one day save your life. In cardiac emergencies, time is everything. Irreversible damage starts at 20 minutes. By 90 minutes, heart tissue turns to permanent scar tissue, and scar tissue doesn't pump. In the ER, we say it simply, time is muscle. Men typically feel classic symptoms: chest pressure, left arm pain, shortness of breath. Women experience subtler signals: extreme fatigue, nausea, jaw or back discomfort, or what feels like bad acid reflux. A sudden, unexplained sense of doom is also documented. Never rationalize it away. Blood work tells you what's in your blood, not what's on your artery walls. You need imaging. A coronary artery calcium scan detects hardened deposits fast. Score of 0, reassuring. Above 400, Serious red flag. A CT coronary angiogram reveals soft, unstable plaques before they calcify. The early warning system that actually matters. Add blood pressure control, blood sugar management, and consistent exercise, and you've addressed the real root causes. The healthy heart attack is a tragedy of assumption. Feeling fine is not the same as being fine. Your body is extraordinarily good at hiding what's building beneath the surface, right up until the second it can't. The scans exist. The prevention works. Act before your heart forces your hand. Don't wait for the symptom with no second chance.